Hello and welcome back to the Vet Scholar. In today's episode, we're diving into a common endocrine disorder in dogs, hypothyroidism. Hypothyroidism is the most prevalent thyroid disease in canines and affects about 0.2 to 0.8% of dogs. So it's something we really need to keep an eye on in specific dog populations. Now, before we get into the details, let's briefly touch on the anatomy. The thyroid gland in dogs consists of two lobes on either side of the trachea. These lobes are made up of follicles filled with a storage material called thyroglobulin. This thyroglobulin is the precursor to thyroid hormones, which brings us to the next key part, how the thyroid actually works. The thyroid gland produces two main hormones, thyroxine, T4, and triiodothyronin, T3. These hormones are synthesized through a complex process catalyzed by an enzyme called thyroid peroxidase, TPO. In the bloodstream, about 60% of T4 and T3 are bound to thyroxine-binding globulin, with the rest being loosely bound to other proteins, making them highly protein-bound in circulation. Hypothyroidism can be classified into two major categories, congenital and acquired. Congenital hypothyroidism, though rare, can occur in certain breeds like French bulldogs, Spanish water dogs, and rat terriers. It's typically due to a defect in thyroid hormone synthesis, which can be passed down as an autosomal recessive disorder. In other cases, hypothyroidism may result from iodine deficiencies or from certain drugs given to the dam during pregnancy. But let's focus more on acquired hypothyroidism, which is much more common. There are two types of acquired hypothyroidism, central and primary. Central hypothyroidism is rare and accounts for less than 5% of hypothyroidism cases. It typically results from pituitary tumors or trauma that affects hormone production from the brain. This leads to degeneration of the thyroid gland itself, but this form of the disease is uncommon. Primary hypothyroidism, on the other hand, is by far the most common. There are two main pathological processes behind it: lymphocytic thyroiditis and thyroid atrophy. Lymphocytic thyroiditis is an autoimmune condition where the immune system attacks the thyroid, causing inflammation and eventual destruction and atrophy of the gland. Patients with lymphocytic thyroiditis have high circulating thyroglobulin autoantibodies, TGAA. As a result, the processes may reflect a continuum of the disease. While the cause is unknown, certain breeds have a high prevalence of TGAA positivity. This includes the English Setter, Doberman Pinscher, and Golden Retriever are genetically predisposed to this autoimmune form. Hypothyroidism can affect any breed, but purebred dogs are more frequently diagnosed. The average age at diagnosis is around 7 years, with neutered females at higher risk. Clinically, the disease is incredibly diverse in how it presents. The most common signs, seen in up to 70% of cases, are metabolic and dermatological abnormalities. Dogs often show a decrease in metabolic rate, leading to lethargy, weight gain, and exercise intolerance. About 40 to 50% of hypothyroid dogs are overweight or obese, but it's important to remember that not all cases of canine obesity are caused by hypothyroidism. In fact, hypothyroidism only accounts for a minority of these cases. Dermatological signs are very common in hypothyroidism. Hair loss, known as endocrine alopecia, is often non-itchy, symmetric, and typically spares the head and extremities. You may see a classic rat tail appearance due to hair loss around the tail, or a tragic facial expression caused by myxedema, a thickening of the skin due to the accumulation of a substance called hyaluronic acid. Neurologically, hypothyroidism is less common, but can lead to issues like peripheral neuropathies, facial nerve paralysis, and rarely laryngeal paralysis. While the exact mechanisms aren't fully understood, it is thought that the buildup of mucopolysaccharides in the nerves or impaired axonal transport could play a role. Hypothyroidism can also affect various other systems, although these are less common. Cardiovascular abnormalities like bradycardia are observed in about 15% of hypothyroid dogs, but these tend to be subclinical. Reproductive issues like infertility are often debated, but no strong evidence has linked hypothyroidism to major reproductive dysfunction. Interestingly, Hypothyroidism can also impact muscle function, leading to weakness, exercise intolerance, or even myopathy. These signs can mimic other conditions like polyneuropathies, so it's crucial to do a thorough workup. When we investigate hypothyroidism, particularly in dogs, imaging techniques can provide us with a wealth of structural information. However, it's crucial to remember that imaging alone can only tell us about the gross abnormalities present in the thyroid gland. It doesn't give us functional data, which is key to making a diagnosis of hypothyroidism. Let's start with ultrasonography, or US. This is a commonly used imaging technique in veterinary medicine. However, when it comes to the thyroid, results can be operator-dependent, meaning that the skill and experience of the person performing the ultrasound really matter. In a normal euthyroid dog, a dog with normal thyroid function, the thyroid lobes are fusiform or spindle-shaped when viewed in the longitudinal plane and triangular in cross-section. They're surrounded by a smooth capsule and appear homogeneous on the ultrasound, meaning the echogenicity or brightness is uniform throughout the gland. The thyroid tissue is typically isoechoic or slightly hyperechoic compared to the surrounding sternothyroid muscles, which means it appears as bright or brighter than the surrounding tissue on the screen. However, in hypothyroid dogs, we often see several abnormalities. The thyroid lobes can become irregular in outline, lose their spindle-shaped appearance, and appear reduced in size. The tissue also becomes heterogeneous and hypoechoic, meaning it looks darker on the ultrasound. These changes may not be symmetrical, as the two lobes can be affected differently, which adds another layer of complexity. While ultrasound can be helpful, it's not foolproof. Dogs with non-thyroidal illness, NTI, conditions unrelated to the thyroid, can have thyroids that look similar to healthy dogs, making it difficult to distinguish NTI from true hypothyroidism based on ultrasound alone. Furthermore, breed differences can significantly affect what a normal thyroid looks like, which needs to be considered when interpreting the results. Next, let's talk about CT and MRI. These imaging modalities offer more detailed cross-sectional views of the thyroid gland and can help us assess its structure in greater detail. CT and MRI are particularly useful when we suspect thyroid neoplasia or tumors, but like ultrasound, they do not give us functional information about how well the thyroid is working. This is where laboratory tests come into play. Now that we've discussed the structural aspect, let's move on to the functional side of diagnosing hypothyroidism through blood tests. When evaluating for hypothyroidism, one of the most commonly used tests is the measurement of total T4, TT4. This test gives us an idea of the circulating levels of T4 in the bloodstream. In hypothyroid dogs, low TT4 levels can raise suspicion, especially when combined with elevated thyroid-stimulating hormone, TSH levels. An increased TSH and decreased TT4 are highly suggestive of hypothyroidism because the pituitary gland is trying to stimulate a failing thyroid to produce more hormone, but is unsuccessful. However, TT4 alone isn't always definitive. Several factors such as non-thyroidal illness, NTI, or the administration of certain drugs like steroids can cause a decrease in TT4, even in a dog with normal thyroid function. That's why we need to look at the complete clinical picture, including the dog's history, physical exam findings, and other lab results, before jumping to conclusions. One test that's often questioned is the measurement of total T3, TT3. While it might seem logical to test both thyroid hormones, T4 and T3, measuring TT3 has limited diagnostic value for hypothyroidism. In fact, up to 90% of hypothyroid dogs will have TT3 values that are within or even above the normal reference range. This may be due to increased secretion of T3 from the thyroid or enhanced conversion of T4 to T3. So as a rule of thumb, we don't rely on TT3 as a primary diagnostic tool for hypothyroidism. There's also another factor to consider: thyroglobulin autoantibodies, TGAAs. TGAAs are antibodies that target thyroglobulin, a protein produced by the thyroid gland. A positive TGAA test is strongly associated with lymphocytic thyroiditis, an autoimmune condition that can lead to hypothyroidism. The presence of TGAAs doesn't necessarily mean that a dog is hypothyroid at that moment. In fact, these antibodies can be present long before clinical signs of hypothyroidism appear. So while they don't give us functional information about the thyroid, TGAAs do tell us that there's underlying thyroid disease. Additionally, TGAA results are rarely positive in dogs with NTI. So if we get a positive TGAA test, it adds more weight to the suspicion of hypothyroidism. Now let's pivot to treatment, which is where we really see a difference in how hypothyroid dogs live their lives. If a dog is diagnosed with hypothyroidism, they'll need thyroid hormone replacement therapy, or THRT, for the rest of their life. The go-to treatment is synthetic T4, which replicates the natural hormone that the thyroid gland produces. Now you might wonder, why not just give T3 instead? Well, there's a good reason for that. T3 is actually the more active form of thyroid hormone. But by giving T3 directly, we bypass the body's natural process of converting T4 into T3. This can increase the risk of thyrotoxicosis, which is when the thyroid hormone levels in the blood get dangerously high. Plus, T3 has a much shorter half-life, meaning it doesn't stay in the body for long, so it requires more frequent doses. And finally, giving T3 might lead to a T4 deficiency in specific organs, like the brain or the pituitary gland. The full impact of that is still a bit unclear, but it's not something we want to risk. So T4 is the standard choice, and it's available in both tablet and liquid forms. Luckily, with proper management, the prognosis for treated hypothyroid dogs is excellent. Now let's talk about T4 supplementation and how it works. A healthy dog's thyroid gland secretes about 2.5 micrograms of T4 per kilogram of body weight each day. But when we're treating a hypothyroid dog, we need to give a dose about 4 times that amount intravenously just to normalize their T4 levels. And when we administer T4 orally, the dosage needs to be even higher. Why? Because gastrointestinal absorption of T4 is notoriously poor. Depending on the dog's stomach contents, diet, and even the bacteria in their gut, only 10 to 50% of the T4 they take in will actually make it into their bloodstream. There's something important to note here. Food significantly reduces the bioavailability of T4. In fact, feeding a dog right before or after giving them T4 can reduce the hormone's absorption by almost half. So it's crucial to keep feeding and dosing times consistent, especially when we're planning a day of monitoring. And keep in mind, the bioavailability, or how much of the drug is available to the body, varies between different T4 products. Some generic brands might not work as well as others, and even some proprietary products can differ. When it comes to dosing frequency, most dogs do well with either once daily or twice daily dosing. After the dog takes the T4, it's rapidly absorbed, reaching its peak concentration in about 3 to 6 hours. It's then metabolized over the next 9 to 15 hours, so dosing adjustments depend on how well the dog is responding. At higher doses, the half-life of T4 is shorter, meaning the body processes it faster, which can affect how often we need to give it. What about side effects? Dogs are surprisingly tolerant of high levels of T4. In fact, they can handle up to 10 times the standard dose. That's around 20 micrograms per kilogram per day, without significant problems. But if a dog is getting too much T4, you might notice signs like excessive drinking and urination, increased appetite, weight loss, panting, hyperactivity, or a faster heart rate. These signs usually resolve within a few days after we stop the treatment or lower the dose. Sometimes, despite being on T4, a dog won't respond as expected. This can happen if we haven't reached the right circulating hormone levels yet, so we usually adjust the dose. However, in some cases, like when a dog has gastrointestinal issues affecting T4 absorption, we might need to switch to T3 therapy. And that brings us to the end of today's discussion on hypothyroidism. Remember, it's all about understanding the bigger picture, combining diagnostic imaging with thorough treatment protocols. Thanks for watching, and don't forget to like and subscribe to The Vet Scholar for more deep dives into veterinary medicine. hypothyroidism. Lastly, here are some key points from the lecture.